Death. It is the one certainty in life, yet we often shy away from discussing it. However, understanding mortality, the rate at which people die, is crucial for grasping the health of a population. Mortality statistics, though seemingly morbid, provide a window into the well-being of societies. They reveal trends, disparities, and areas where interventions are needed most. These numbers tell stories of progress in medicine, of persistent inequalities, and of the challenges we face in ensuring long and healthy lives for all. By delving into these statistics, we gain insights that can guide public health policies, resource allocation, and ultimately our understanding of the human condition. Analyzing mortality involves looking at different measures, each offering unique perspectives. Crude death rates give us a general sense of mortality, while standardized mortality ratios, SMRs, allow comparisons between populations with different age structures. Infant mortality rates, IMRs, on the other hand, highlight the vulnerabilities of the youngest members of our society. This exploration of mortality statistics aims to shed light on these measures, their interpretations, and their profound implications for individuals and populations alike. By confronting the reality of death, we can work towards a future where everyone has the opportunity to live healthier, longer lives. The most straightforward measure of mortality is the crude death rate. This simply represents the number of deaths per 1,000 people in a given population over a specific period, usually a year. It provides a general sense of how many people are dying relative to the total population size. For example, a crude death rate of 8 per 1,000 means that for every 1,000 people in a population, 8 died within that year. While seemingly simple, crude death rates can be influenced by a variety of factors, including age distribution, disease prevalence, and access to healthcare. However, crude death rates don't tell the whole story. A country with a high proportion of elderly people will naturally have a higher crude death rate than a country with a younger population, even if healthcare quality is similar. This is where the need for more nuanced measures, like standardized mortality ratios, becomes apparent. These ratios allow us to make fairer comparisons between populations with different age structures, providing a clearer picture of mortality trends. To compare mortality across different populations more accurately, we use standardized mortality ratios, SMRs. SMRs adjust for the age distribution of populations, providing a more accurate comparison of mortality risks. This is crucial because age is a significant factor influencing mortality. Imagine comparing the crude death rates of a retirement community and a bustling university town. The retirement community would likely have a higher crude death rate simply due to the older age of its residents. This doesn't necessarily mean the retirement community is less healthy, just that age is a major factor in mortality. An SMR of 100 indicates that the observed number of deaths in a population is as expected based on the age-specific death rates of a standard population. An SMR greater than 100 suggests higher than expected mortality, while an SMR less than 100 indicates lower than expected mortality. By using SMRs, we can make more meaningful comparisons between populations. For example, we can compare the mortality rates of two countries with very different age structures, like Japan with its aging population and Nigeria with its relatively young population. This allows for a more accurate assessment of factors contributing to differences in mortality beyond just age. Infant mortality rate, IMR, is a particularly poignant statistic. It measures the number of deaths of infants under 1 year of age per 1,000 live births in a given year. IMR is a sensitive indicator of a population's health and well-being, reflecting factors like access to healthcare, nutrition, and sanitation. High IMRs are often seen in countries with limited access to quality healthcare, poor sanitation, and high rates of poverty. Conversely, countries with well-developed healthcare systems, good nutrition programs, and strong social safety nets tend to have lower IMRs. Reducing IMR requires a multi-pronged approach. This includes improving access to prenatal and postnatal care, ensuring adequate nutrition for both mothers and infants, and providing safe and clean environments. Additionally, addressing socioeconomic disparities is crucial, as poverty and lack of education often contribute to higher IMRs. Efforts to reduce IMR have made significant strides globally. However, disparities persist, highlighting the need for continued focus on improving the health and well-being of the most vulnerable members of our societies. Section 5. Geographic disparities, location, location, location. Mortality rates can vary significantly across different geographic regions. These variations can be attributed to a complex interplay of factors, including access to healthcare, environmental factors, lifestyle choices, and socioeconomic conditions. Understanding these geographic disparities is crucial for developing targeted interventions and improving health outcomes. For instance, rural areas often experience higher mortality rates compared to urban areas. This can be due to a combination of factors such as limited access to healthcare facilities, higher rates of poverty, and increased prevalence of certain risk factors like smoking and obesity. Urban areas, while generally having better healthcare access, can face unique challenges like air pollution, high stress levels, and infectious disease outbreaks that can impact mortality rates. Moreover, within urban areas, significant disparities often exist between affluent and disadvantaged neighborhoods. Addressing geographic disparities in mortality requires a comprehensive approach that considers the unique challenges of different regions. This includes improving access to healthcare in underserved areas, addressing environmental health risks, promoting healthy lifestyles, and tackling socioeconomic inequalities. Socioeconomic factors cast a long shadow on mortality. Income, education, and occupation are closely linked to health outcomes. People with lower socioeconomic status often experience higher rates of mortality and shorter life expectancies. This is due to a complex interplay of factors that contribute to a health gap between the rich and the poor. Access to quality healthcare is a major factor. People with lower incomes often face barriers to accessing affordable healthcare, including lack of insurance, high out-of-pocket costs, and transportation challenges. This can lead to delayed diagnoses, inadequate treatment, and ultimately, poorer health outcomes. Education also plays a significant role. People with higher levels of education tend to have better health literacy, enabling them to make healthier choices. They are more likely to be employed, have health insurance, and live in safer neighborhoods, all of which contribute to better health. Addressing socioeconomic disparities in mortality requires a multi-sectoral approach. This includes expanding access to affordable healthcare, improving education and job opportunities, and creating healthier environments in disadvantaged communities. Mortality statistics are not merely numbers on a page. They are powerful tools for improving public health. By analyzing mortality trends and patterns, public health officials can identify areas of concern, prioritize interventions, and track progress over time. For example, if a particular region shows a spike in deaths from heart disease, public health officials can investigate the underlying causes. Are there high rates of smoking or obesity? Is there limited access to healthy food options or opportunities for physical activity? By identifying these factors, targeted interventions can be implemented, such as promoting smoking cessation programs, encouraging healthier diets, or creating more walkable neighborhoods. Mortality data can also help track the effectiveness of public health interventions. By monitoring trends in mortality rates, officials can determine whether specific programs are having the desired impact or if adjustments are needed. Mortality statistics also provide valuable insights for predicting future health trends and planning for the needs of aging populations. By analyzing historical mortality patterns and projecting them into the future, demographers and policymakers can estimate future healthcare needs, pension liabilities, and social security burdens. For instance, as life expectancy increases globally, understanding the dynamics of aging populations becomes crucial. Will people live longer but with more chronic conditions, requiring more extensive healthcare? How will this impact the workforce and social security systems? By using mortality data to forecast future trends, policymakers can make more informed decisions about resource allocation, healthcare infrastructure development, and social programs to support aging populations. However, predicting the future of mortality is not an exact science. Factors like medical breakthroughs, emerging diseases, and environmental changes can significantly impact mortality rates in unpredictable ways. Mortality statistics, though often perceived as grim reminders of our mortality, are in fact powerful tools for understanding and improving the health of populations. They reveal trends, disparities, and areas where interventions are needed most. By analyzing crude death rates, standardized mortality ratios, infant mortality rates, and geographic variations, we gain a deeper understanding of the factors influencing how long and how well we live. These insights are crucial for guiding public health policies, resource allocation, and ultimately, our efforts to create a healthier and more equitable world. While mortality is a natural part of life, understanding the factors that influence it empowers us to take action. By addressing disparities, promoting healthy lifestyles, and ensuring access to quality healthcare, we can strive to create a future where everyone has the opportunity to live longer, healthier lives.